guys, Shelby and Amara. This is my cute patient for the day. We're going to do a little bit of, I don't know, a couple different treatments live for you, and these things make me nervous. Okay, so this is what we're doing. I'm going to kind of assess her up close so you guys can see, and you guys can come and zoom in if you want. So what we're going to be doing is looking at this beautiful, lovely mermaid of a patient here. We're going to do a little bit of tear trough filler. Can you tilt your chin down and look straight at the camera for us? You guys see this hollowing under her eyes here? It's actually super common. Sometimes it's due to genetics and other times it's just due to, you know, over time we lose volume. The orbit of the eye kind of elongates and sets back a little bit in the skull. So over time our eyes get more and more hollow, and it's actually super, super easy to fix with a little bit of filler. Yeah. So it's one thing that I kind of specialize in. I do a ton of under eye filler, and I've trained a lot of people on it. It's just the one treatment that has probably the biggest patient satisfaction. People just love being able to look a little bit more awake and get rid of the darkness. So it doesn't get rid of the pigmentation under the eyes. That's important to know. When she kind of looks up, it almost looks like a little bit darker than it really is, and you'll see in her before and after, which I'll post. It makes your eyes look a lot brighter because you don't have the shadowing from the hollowing underneath the eye. So when you kind of pop that up, you get a smoother transition and it looks a lot brighter. So
makes sense.
We are also going to be doing a little bit in her lips. So she has gorgeous little lips. We've done her lips in the past, but we went, sorry, I'm shaking. I can't do this with one hand. So we've done her lips in the past with just like half a syringe. But we're gonna be doing a little bit of Volbella. So we have a special going on called the Lip Hydration Special. It's only $350 to hydrate your lips. And it adds a tiny, tiny bit of volume, and we can sharpen out the lip a little bit with it and just overall hydrate the lips. After summer, I feel like we all lose a little bit of volume and hydration in our lips, so it's an after summer special for hydrating the lips for $350. So
that's so good.
That's what we're doing. I'm gonna hand off the camera here. Oh my gosh, let's see. There you go. Okay. So we've already done a consult. We already know what we're doing. I've already talked with the patient, which is my cute friend. So we're just gonna get started, and then I think I'm getting some questions. You guys can ask questions in between, and we can kind of talk about it as we go. Oh, let's introduce Savannah.
Oh, yes.
Go ahead.
Hey guys, I'm Savannah. Just this cute girl's MA. So
Sav's my medical assistant. She's my right-hand woman. She helps me bring all my patients back, does part of the consultation, make sure all the paperwork is done and everything is good to go. She keeps me in line, so she's awesome. Okay, so we're going to start with her under eyes first. We've already wiped her makeup off. We're going to cleanse, and I'm just going to get started, okay?
I'm excited.
So a lot of people ask what this guy is. It's not magic. It's just a little gold vibrata. It vibrates and it just distracts the nerves. So they've done studies that show your nerves sense vibration stronger than pain. So I just have my patients hold it on their chin, and you can hold it as firmly or as soft as you want. It just helps distract the nerves. This really doesn't hurt a lot because I numb with a little bit of local anesthetic into the entry point. So it's really not bad at all. So, cover the speaker. My phone gets muffled often. Sorry. Okay, perfect. This is what I cleanse the skin with. Kind of keeps it nice and clean so we don't get any infections.
Okay, I have a question for you. With the lip hydration treatment, how many cc's are used from the Volbella?
The whole Volbella syringe, which is it's about 0.6 of a syringe, so a little bit more than half a syringe. So I'm just numbing her right now. So she'll like me later. So this is just a little needle. It's 25 gauge. It makes a little entry point for the blunt cannula that we're going to use. I don't know if this is going to work, but you guys can get up real close. Do you see how this one's nice and sharp? That's what penetrates the skin, creates a little opening, so I can slide this in, which is blunt, which won't penetrate the skin. So you slide this guy in. This is blunt. A blunt tip cannula. It decreases bleeding, bruising, swelling, and decreases pain. So. Just a little bit of pressure. So numb on those lips. We numb the lips. Lips are a little tender, so we use a really good medical grade strength numbing cream to help numb the lips, so it's not too uncomfortable. Probably on the switch sides. Yeah. Hold this little guy. Hold your hair back. The mermaid hair is in the way. Make sure you keep that out. Perfect. Okay. Keeping it nice and clean. So, can you feel this little guy out? Just a tiny bit. You dropped the bed a tiny bit. I'm such a shorty. People ask me how tall I am in real life. I'm only 5'3". So. My husband's 6'4". Makes for a good time. He's like a foot taller than me. Sound makes me look short every day. So I was basically a model.
Whatever.
Okay, so I'm just sliding the cannula in. Okay, so I'm going to have you open your eyes and look straight ahead, kind of right above the door there. When we do tear troughs, I correct looking straight ahead, so I have the patient open their eyes. This has numbing in it, so your eye can feel kind of like numb and tingly. That's totally normal. You can blink whenever you need to. Okay. So it's a little tender, just right towards the nose. We'll place a little product here.
So someone asked, what product are you using?
Restylane. And I have my own little way that I do it, and I offer private training, so if anyone's interested in knowing kind of our secrets and stuff, just direct message me, and we'll send you info on trainings. But the product is Restylane. Just the plain normal Restylane with lidocaine.
So someone just joined and they're asking what you're doing.
So we're just doing a little bit of tear trough filler, which is under eye filler. A lot of people don't know what the tear trough is. It's just putting filler in the hollowing under the eyes. How are you doing?
So good.
So hurts so good. Just kidding. This doesn't really hurt. It's more like a weird sensation because this is blunt. It's not sharp, so it doesn't really hurt. It's just kind of weird.
What kind of topical numbing do you use for the lips?
It's a benzocaine, tetracaine, lidocaine mix. So it's awesome. Good.
What are the risks of this treatment?
That's a good question. The main things you're looking at are bleeding, bruising, swelling. The worst thing that can ever happen with filler is if we occlude blood flow, and it's really rare, and it's even more rare using a blunt cannula, but that is a risk. We can treat it right away, but it's a known risk. There have been cases of blindness when using filler in this kind of central area, but that's mainly with needles, and it's, again, very extremely rare, and even more rare using a cannula. So we always play it very, very safe, and we under treat the patient because this is the one area where you never want too much filler. You never ever want to look like overfilled under the eyes because it's kind of a dead giveaway that you have filler.
Do you aspirate when using a cannula?
Sometimes it depends on where I'm at in the face, but in the under eye, I just inject retrograde and I make sure I'm on the bone, so I know I'm in a plane where, you know, it's safer, and I just inject retrograde as I pull back. Okay.
Can you explain the difference between retrograde and aspirating?
Awesome. So aspirating is when you pull back on the plunger to make sure you're not in a blood vessel. Injecting retrograde is just when you pull back as you're injecting. Does that make sense? Awesome. Your chin just like that. So already looking so much better. I think she just needs a little bit more kind of in the center there. And again, I'm very, very deep. I'm on bone. Will you tell them how much tear trap costs?
Yeah, so it's per syringe, and for Restylane we charge $600 a syringe. So a lot of the times we'll just start with the one, but it is a two-step process, so we'll have you come back and we might need to layer a little bit more to fully correct you.
It's usually 1 to 2 syringes, so $600 to $1,200. That's why there's a pretty wide range, but it's just because we sell only by the syringe. We don't break it up.
How are you doing?
Good.
Your brows are on fleek, girl.
Why don't you tell them what you do, Chanel?
So I'm Chanel. I work at Amara at the Lehigh and Orem location, and I specialize in brow waxing and tinting and lash lifts and tips.
So I heard brows are on
Yeah.
Okay, relax your head.
How much lidocaine did you use to numb the area before injections?
I actually use Marcaine. I like Marcaine a little bit better. It lasts a little bit longer. And I use a tiny, tiny bit, like 0.2, buffered with a little bit of bicarb.
Do you typically treat cheeks and tear troughs together or vice versa?
Yeah, I do. It's pretty common to need a little bit of mid-face support. She's young and still has really great projection in her mid-face, which supports the tear trough. If you have flattening in the mid-face, I'll definitely need to put cheek filler in you to, one, give support to the tear trough, but also to help lift the face. Just gives an overall really nice, flawless look.
How long do you wait to do the second treatment if she needs it?
Usually a couple weeks. A couple weeks is usually just fine.
And then it lasts 9 to 18 months, is that right?
Usually I say about 6 to 12.
6 to 12, okay.
Yeah, it just kind of depends on the person though. If you're only splitting one syringe, that looks pretty flawless. One syringe is a fifth of a teaspoon, only 1/5. So if you split it, it's 1/10 under each eye, which is like the tiniest bit of product. So it depends on how much you inject and then how her body will break it down over time. But I usually give a wide range, like 6 to 12 months. People usually come back for a top off and retreat.
What is Sav doing over there?
What is she not doing? She's my everything. Oh, sorry, I already poked her, so I just looked at her. Yeah, you guys can zoom in and see the difference.
You can
Let's
totally
show
see
you.
the difference.
One side done, one side not.
How long does the tear trough last?
We just answered that, right? Can you listen? Just kidding. 6 to 12 months. And cheeks usually last like 9 to 18 months, depending on how much is injected. The most tender part is just getting it in initially. Okay, open your eyes for me.
Which Restylane is good for tear trough? Refine?
Some people use Refine, some people use Define. I use just plain Restylane. I've used Define before too, and Define looks great too.
What's the difference between those ones?
Those are a different technology of filler. They're like a stretchy filler. They integrate with the body's tissues. So when you move, it kind of moves with you. So those are great for dynamic areas like around the mouth. The tear trough filler kind of just sits where you put it. So I don't know. My go-to is just plain Restylane.
Is this product reversible?
Yes. Every hyaluronic acid filler is reversible. You can dissolve it. So if you hate it, we can dissolve it. But I've never had to do that for someone that I treated with cheeks and tear trough, so that's good. A lot of times we'll also do a little bit of Botox or Dysport around the eyes. Sav, do you want to kind of explain what those are and what they do, like the neurotoxins?
Yeah. So we do both here. We have Botox and Dysport. The difference between them is they're made by different companies. So Botox is made by Allergan, which makes all the Juvederm fillers. Dysport is made by Galderma, and they make all the Restylane line of fillers. So the main difference between them is the molecule size. So it takes 3 Dysport molecules to equal 1 Botox molecule. So with that being said, Dysport does kick in a little bit quicker.
So people have like
Yeah, so if you have like if you are going on vacation or have something that you are going to in the next week, we typically do Dysport, but we like both of them. They're both awesome. And we charge
for each area of the face, maybe.
Alright, so we charge $12 a unit for Botox and Dysport. They're the same price. And typically everyone's Botox Dysport treatment is totally customized. So there's not like a set treatment that we do. Full dose in like the glabella is $25.
People don't know what that is.
It's this area right here between the brows. The 11s, yes. So the max dose is 25. And the range, it can range from whatever, but a lot of people like to do the 25 because it just lasts a lot longer. In the forehead, the max dose is 16. And then around the eyes is 16 around each eye. Yeah, we usually half dose it, just depending, but yeah.
A little bit more. She's looking good. Are you getting pretty numb under there? Because this also has lidocaine in it, the product has numbing in it, so she gets more and more numb as we go, so it gets more and more comfortable as we go.
Can ethnicity play a factor in treatment or replacement of the tear trough area?
Good question. Yeah, I mean, because some ethnicities have thicker or thinner skin, some have different, slightly different bone structure, some have a lot more hollowed eyes than others. So yeah, I mean, everyone's completely different, and each treatment is totally customized to the patient's needs. So I would just recommend coming in and having a consultation. We do free consultations, so if you want to get treated the same day, just make sure you book out enough time. And the girls on the phone, when you're scheduling it, are really great. They can just tell you, the price range and what you're looking at, so you guys can be more prepared as far as, what to do. Oh, we could tell them, pre-care, things to avoid.
Oh yeah.
That would be good to
So
know.
before getting any injections, we always tell people to avoid any blood thinning meds. So ibuprofen, aspirin, vitamin E, Excedrin, fish oil, alcohol, caffeine, all that good stuff. It just helps the injections go a lot smoother, and you won't bleed as much. So in that case, you won't bruise and swell as much. It's just a lot more comfortable for us to inject you and for the patient to get treated. So yeah, and then post-care, we always tell people don't work out for 24 to 48 hours. Because with Botox, if you get super hot and sweaty, it can actually denature the proteins in the Botox. So we always tell people to avoid working out with any injection for 24 to 48 hours. If you're really swollen, you can always take like an antihistamine, like a Claritin or a Benadryl, helps with that. We sell Arnica Montana here, which helps with the swelling and bruising. So we tell people to take that, icing, sleep with a few pillows behind your head the next day, and avoid ibuprofen for like 6 to 8 hours after getting injections.
See, that's why I love Savannah. She just knows everything. She
You're
just.
so smart.
I've just been in this field for quite some time.
You know your stuff.
Yeah. Any other questions, guys?
Yeah, there's if you put Botox in the forehead lines, does it drop the brows?
It can. If you do too much in the forehead, it can totally drop the brows. So we always go light, and I give a little brow lift so you actually feel like lifted rather than heavy. But that Botox is an art. You gotta go to someone who understands the muscles of the face and doesn't overdo it. Look at her, you guys. She's just looking
Looks so
fabulous. So, let's see, Sab. Oh, just a tiny, tiny bit more in here. Sorry, I'm a total perfectionist.
That's a good thing.
Struggle.
Right? It's your face.
Mm-hmm.
Did your phone die?
No, my husband called me.
Oh. No, husband, I cannot. Why don't you tell me about the Technic special, Sam?
Okay, so we also have a special going on for the fine lines. She doesn't really have any, but we can look at mine. For the fine lines on your neck, which everyone gets from looking down on your phone, working on a computer. Me, it's assisting all day. So it's $3.95, and we're using a super smooth product, Vobella, which is the same one we're doing in the lips right now. Well, in a little bit, but we do a little bit more in the neck just because we like to go all the way to the lateral edge and get all those lines. So it's super awesome. It's almost like a magic eraser. So it's cool.
Totally erases the lines. Mine are bad. You can zoom in on mine. In a second here, we're almost done.
Oh, just kidding.
You don't. You must not look at your phone.
No, I do all the time.
Okay, we're done. Yeah, you can look at my neck. I totally have all those lines. Struggles around. I'll probably just do mine in a little bit. Okay, so I'm gonna switch gloves and then we're gonna do our lips. Tear troughs take a hot minute. I mean, you always want to go slow and make sure you're, doing it good and not putting too much product in because she'll swell. You'll be the most swollen the next day. Tomorrow morning, you're gonna wake up, look like uber swollen under the eyes. That's normal, expected, and then it goes away. I tell people to avoid salt for the first few days, especially, and stay hydrated.
No gym.
No gym.
Okay.
For like 24 to 48 hours, depending on how swollen you are and how much you bleed.
Okay.
Okay.
I didn't know. That's good to know.
Yeah.
I just said that.
Well, yeah, I was thinking
you
that when you were
listening?
saying that. Yes, it was.
Were you in the zone or what? This is gonna be a long lab. Whatever. It's fine. Any other questions?
Not yet, no.
I feel like it gave me some cheeks too.
Huh?
I feel like it gave me some cheeks.
Yeah, a little
Yeah,
bit.
define
in
it.
my face. Yeah. Alright. Numbing again. Okay, so I numb the corners of her mouth. I'm going to use a cannula at first, and then we're going to sharpen with the needles at the end. So open up your lips a little bit, Fanny. A little bit of burn.
How bad do the tear troughs hurt?
Not bad. It's just a weird sensation.
I'm just numbing. You're not missing out on anything. The numbing's a little spicy. It kind of burns for like 30 seconds, and then it goes away. Oh, yeah, such a burn. Thank you. Okay, open up for me.
Can you feel the poke at all?
Don't sound so surprised.
I was like waiting for it. I'm like,
Beauty of numbing. So again, I'm using a blunt cannula, decreases trauma to the tissues, and you can see results pretty much right away. I'm going to be trying to look towards Savannah a little bit. Good. I'm just going to slide.
So is
right
it just
in.
a preference of yours to use a cannula?
I use a cannula. I use them for different reasons, but I use both. I mean, it just kind of depends on the patient and what their needs are.
How many procedures can you have done in one visit?
You can answer that one. Sam. There's not a
Yeah.
real limit, but we.
If you're doing HA filler, I mean, you can do as much as you want. I mean, we don't want to put too much in one area at one time. But, I mean, if you wanted to do under eyes, cheeks, lips, jaw, we could totally do it all in one day. But if you wanted to do like cheeks and sculpture in the same day, we would definitely want to spread those out. Probably at least a couple weeks.
What's your favorite product to use in the lips?
Oh man, it depends on the patient. Everyone has different needs, but turn towards Savannah, thanks, sir. It kind of depends on if you want like a really poppy look or if you want more of a hydrated look. Volbella is perfect for like a natural hydrated look, nothing too crazy. If someone's really wanting like a poppy look, I'll use like a Restylane or Juvederm. Look straight ahead. If you can zoom in, you can kind of tell they're just so tight. She wants to keep them very natural, so otherwise her husband would probably kill her, right? So we're going very natural. It's just a little bit more sharpened and a little bit more hydrated. You see the difference there? We'll do final touches at the end. We're just adding a little bit of overall volume right now. So open up a little bit.
Let's see. What has Shelby gotten filled on her face, hoping her cheekbones because I need hers?
Goals. I have filler all over my face. I think the key is just doing an okay amount, not too much, and placing it correctly. I have a full syringe of filler in my cheeks. I have probably more than a full syringe in my lips. Filler under my eyes, and then filler in my smile lines. So, all over.
So let's talk about the preventative measures, because everybody here right now is pretty young.
Yeah.
So yeah, let's talk about the positives and about preventative care.
So, I mean, I started doing Botox when I was, I'm trying to think, like 20? Started 20. The main reason I started doing it is because I'm super expressive with my eyebrows. So I always raise, and I was creating those wrinkles on my forehead, and I would get headaches. So I started doing it for that. But I also do it like around my eyes because I'm nearsighted, so I squint all the time, even if I have contacts or glasses on. So it's really good to just, you know, kind of baby dose it. Helps prevent those lines getting deeper, you know, but makes the aging process go a lot smoother. So, and same with filler. Like, I mean, I'm 24 and I have things done too. I have things done. I don't want to know. I have things done in my face.
Tell them what I've done on you, Sarah.
Okay, face by Shelby, you guys. Literally. She's done my cheeks, which is my absolute favorite because I don't really have a lot of shape to my face. So she did my cheeks, helps contour that. She did my tear troughs because I had a teeny bit of hollowing, which is genetic. Most people do have hollowing, so we did that. She's done my lips and my Botox.
Yeah, Botox. Ooh, talk about Botox in the chin and in the nostrils.
Okay. Yeah, so other places you can put Botox in Dysport is in the chin. So if you get like a dimply chin, which she does mine because I get the dimply chin. So takes about 6 to 8 units, helps smooth it out, which is really awesome. We also do Botox or Dysport in the masseter muscles, which is just this muscle over here. And a lot of people will do it because they clench all the time and it gives them headaches or they're grinding their teeth. So it helps prevent that. But it also slims out your face a little bit too, which is nice. So, and typically just depending on how big the muscle is how many units we would do on each side. So.
Chanel, how are you doing?
Good.
Lips are a little bit more
I'm hanging
tender,
in
but
there.
she's doing good.
You don't look like you're in pain, so
Oh, good.
Prime model.
What is the best treatment for lip lines?
This, what we're doing right now, just adding a little bit of filler. People don't know, but filler is made of hyaluronic acid, which is a natural component you have in your body in between your cells that gives you hydration and fullness to your skin. It sits in your joints, lubricates your joints. So it's actually very hydrating. And that's all the fillers that I use. They're all hyaluronic acid fillers. So just hydrating the lips helps get rid of those lines.
Does filler dissolve evenly?
It depends on who placed it and how much is in each area. I've had to fix some pretty lumpy lips. Although it's normal to have lumps after filler, I tell every single one of my clients that sometimes the filler molecules like to find each other and sometimes they like to clump up, and that's totally normal. So I usually encourage my clients to kind of massage their lips, and if at 2 weeks after they still feel a little bit bumpy, I have them come back and I massage their lips out for them.
What areas do you always aspirate besides the cheek and nasal folds?
Anywhere I'm using a needle, always. Anywhere on the face.
Somebody wants to know the prices for what you're doing right now.
The pricing?
Mhm.
Good question. Do you want to tell them the pricing, Sarah?
Yeah.
This is hard, I'm
So-
like concentrating.
Yeah, so right now we have our special going on, which is the lip hydration special, which is what we're doing right now. And it's $3.50. So, and normally it's $4.50 for a syringe. So it's a good deal.
and that goes through September 20th.
September 20th. Yes.
Sure. Ah. September 20th. Okay, I'm going to still this for you. I'm going to sharpen your cupid's bow out a little bit. This is probably more sensitive area. Actually, I'm going to use an insulin needle because I'm going to show people how I do it. I get this question all of the time. Will you hold that for a second? This is an insulin needle. It's 12.7 millimeters, 31 gauge needle. So, pop the back out. Put on the needle that comes with the filler. Stick it in. Squirt it in. That way, this is a lot smaller diameter. I have really tiny hands. I feel like I have more control over, sorry, I just put the plunger back on and it pushes all the air back out and we're good to go. So I feel like I have a lot more control over this than that syringe. It's smaller, pushing smaller amounts, especially when you're doing detailed work in the lip. Okay, girlfriend, you ready? Oh, where's the Goldie? Sorry. Little Goldie helps a lot. It's just a tiny hook. Good. Good.
What are suggested trainings and certifications if you wish to pursue injecting?
Go for it.
Gosh.
We get that question. 8,000 times.
Yeah, I mean, to get certified, I would go to like a medical aesthetic school. So in Utah, we have NEMA, which is like a really big one that a lot of people go to. And then just kind of getting your foot in the door, training with a plastic surgeon, you know, kind of learn that way. And then the Allergan and Galderma reps too, they'll always kind of inform you on training. So just go to as many as you can and keep learning.
Almost done. Just a little bit of sharpening in this area helps the lips to look a little bit more feminine, which I really like. Most girls do. Although we do guys' lips too. We've done quite a few guys' lips lately. Men lose volume in their lips too, and who do we kiss? We kiss guys. Right? They need good lips too.
They totally do.
Yeah. So we do guys' lips all the time.
And then you just did a guy's tear troughs the other day as well.
Oh yeah. We do filler on guys often. So if your husband have bags under their eyes, send them in. Sorry, one more little guy over here.
Pretty.
I'm gonna do a couple little strips over here, so open your lips for me. Just a tiny, she just needs a tiny bit more volume over here. I usually use a ton of different techniques for the lips. She just needs a little bit more volume on this side. It's not uncommon to be asymmetrical. A lot of people have more volume on one side than the other. So we try to even it out as much as we can with this one.
Someone said, good to see she's not in a lot of pain. That's what really makes me not want to do Botox is the pain.
Botox is a breeze.
Yeah.
It does not hurt.
Botox is like popping is it. It's how it feels. It's not bad at all. Okay, so we're done, guys. Let me sit her up. You guys can take a look at her and then I can push the right button here. How you doing?
So good.
Yeah, it's wet, guys. Okay. Get them all cleaned up, and then we'll take some pictures. Okay, close me. Yeah, you guys can zoom in fresh off the needle. There's a lip hydrate treatment with a bunch of different techniques. They look so pretty. Nice. She didn't bleed too bad. It's normal to bleed, guys. Bleeding's normal. We're putting needles in your face. There's a lot of vessels in there. Look good? Okay.
Awesome.
Until next time.